Thank you for accepting my invitation to facilitate a workshop for the International Society of Hypnosis.
Thank you as well. I'm delighted to be here and very excited about the workshop.
I'm very excited too. Okay, I'm introducing Dr. Carolyn Daitch, PhD, who is going to facilitate a workshop which I'm sure that will be a very practical one about an anxiety management toolbox. Right. Anxiety is quite common, and we know that there are a lot of approaches that approach to treat anxiety, but I know that she has a very special approach. Carolyn, would you please let us know what are you going to teach us in the workshop?
Well, I'm going to be teaching how to manage anxiety, specifically panic disorder and generalized anxiety disorder, and to manage it. And note that I said manage it, because the illusion that some people have when they come into therapy is that they're going to get rid of it. And that's not realistic. In fact, when I was a young psychologist, that's what I was trying to do to help them get rid of it completely. It doesn't happen, but they can get really good at managing it using some pretty basic tools. And those tools include mindfulness, essentially catching the feeling and not fighting it or the somatic response, and then moving into calm with hypnosis. And then once someone is in calm, one of the advantages of hypnosis is the nervous system calms down, and then you can listen to your own wise counsel or your therapist's wise counsel. So I think it's a really good approach for people. And there's been lots of research over the years. A multimodal approach is more effective than a single approach.
Great. Yes, I agree. And I know that you have already written 4 books and published and conducted a lot of researches.
Yes, I've written 4 books, and all of them have these themes of utilizing these approaches. And there's an article that I can send you, and you can share it with the participants in the ASH journal, where it spells out how I use them with somebody with generalized anxiety disorder.
Okay, great. And I agree with you that conjunction of hypnosis with other approaches usually augment the therapeutic results of those approaches.
Absolutely. There's been a couple of research studies that shows that cognitive therapy in particular is more robust if they add hypnosis with it.
Yes, exactly. And I know I read a paper that was telling that adding hypnotic techniques to CBT will increase the outcome by 70%.
Right, right. That's what I'm familiar with too, that research on 70%.
Yes, exactly.
Hypnosis can do is that some of the difficulties that we all have is to get people to comply. We teach them cognitive approaches, we teach them self-soothing techniques, and they don't use them unless they're in a crisis. And so part of the hypnotic intervention is actually having them imagine complying. Imagine the next time that you're worried about something, that you catch it and say, there's the anxiety. Oh, there's that feeling in my chest. There's that tension, and then move into calm. So it reinforces the at-home practice, which is essential, absolutely essential from my perspective.
Exactly. I know that you are going to focus on panic disorder and GAD, generalized anxiety disorder.
Right.
And I know that GAD is a disorder that is really bothering for the patients.
Yes.
Do you have any particular technique or approach for that?
Yeah, I do. Well, first of all, again, with somebody who's anxious, I'd have them start generally with mindfulness. Oh, there's the worry. There's the worry about that presentation or whatever it is. And then I'm going through it quickly, but ask them where they're feeling it in their body and how they're feeling it emotionally. And then there might be an image of it floating away on a cloud or on leaves in a stream, that kind of thing. And then we get into the cognitive. The cognitive is actually a lot of the CBT things where you write down, say, CCC, catch the thought, challenge it, and change it. That's a classic one. Or taking your worried thoughts to court. That's a fun one that I use, being the prosecutor and the defense and the judge. And we can use hypnosis to add visualization for the CBT approaches, which again potentiates the CBT. And so we can do it that way. The other thing that is true with people with GAD is they cannot stand uncertainty. Most of us don't like it, but they really can't stand it. So I also use just a cognitive approach when they're in a state of hypnosis, saying to themselves, I don't like uncertainty. I don't want uncertainty. And I can handle uncertainty. And again, if they're in that relaxed state, it may be embedded more. Hypnosis also can do our standard safe place imagery that we all know how to do. And then a specifically hypnotic approach, I shouldn't say specifically because other people may have come up with this, but we can have a dual perspective, like a split screen. I do the juxtaposition of two thoughts and feelings, maybe having the worried part on one arm and the competent feeling of self-agency in another arm, and then bringing them together. We can also use hypnotic dissociation to separate the mental from the physical arousal. So there's going to be a lot of really practical, easy to learn and easy to teach techniques for the participants.
Exactly. Okay, so I'm excited to participate in your workshop and learn a lot from you.
Oh, I'm delighted. And it's so nice to see you after all these exchanges of email.
Exactly. So I'm looking forward to your workshop, and I'm inviting all the people who are interested in the subject, those who are an ISH member and those who are not yet an ISH member. I'm sure that this workshop will give you a very potent tool to help your patients to get rid of the bothersome anxiety.
Right. Well, thank you.
Thank you, Caroline. See you.
See you soon. Bye-bye.